a question prior to today, not to worry. You can still submit questions using the Q&A feature, which you can find on your menu toolbar in the Zoom screen. And then out of respect for everybody's time, we plan to end our program promptly at 10:45 today. We will try to respond to as many questions as time allows. If we run out of time before addressing the question you submitted, we will be in touch with you directly following today's session. We do not want any questions to go unanswered. And then finally, please note that this morning's session is being recorded and we will make the recording available to all next week. Now, without further ado, I'd like to address our speakers today. First, Dr. Elliott and then Dr. Dana Mueller. Dr. Tollie Elliott is Mary Center's Chief Executive Officer, and he took on the role of CEO at the beginning of 2022. Prior to taking on that role, he served as Mary Center's Chief Medical Officer for 7 years. As Chief Medical Officer, Dr. Elliott led the development and implementation of the first telemedicine program in the District of Columbia at a federally qualified health center. Of course, alongside Dr. Elliott, we are joined today by Dr. Dana Mueller. Dr. Mueller is the Vice President of Medicine at Mary Center, and she has been with Mary Center for nearly 10 years. Her areas of clinical interest include caring for older adults with chronic medical conditions, obesity management, and gender-affirming care. And then in her role as VP of Medicine, Dr. Mueller, who continues to see patients 60% of her time, oversees clinician recruitment, staffing, and works with the operations team to develop workflows to address the changing needs of the clinic. So that is a brief bio and intro for Dr. Elliott and Dr. Mueller. And now I will hand over the baton to Dr. Elliott.
Well, thank you, Sarah. And I want to thank the supporters most importantly. It is definitely, it's always appreciated. More opportunities are always desired to engage with the supporters as much as we can. The contributions that you all make, both just by word of mouth, financially, it just means so very much to all the services that we do. And I wanted to give a shout out to Dr. Mueller in that he was alongside me when we created a telemedicine program. He was actually one of the physicians we selected first because I knew that she would be quick to say, yes, let's do this. And that she was not going to be the one that was going to be like, yeah, I don't think this is going to work. And so with that, we saw so many tremendous things that came out of that and really allowed us to get through the pandemic in some pretty incredible ways. But as you know, we've been around since 1988, focusing on pregnant women from Latin America, from war-torn countries. And what is so crazy about all this is that with a grant of $250,000 for 200 women has now blossomed and grown to roughly 65 across DC and Maryland. And so we have representations from 50 different countries. We have 5 full service centers with 3 in the district, there's 2 in Maryland. We have 1 in Prince George's County. We will be giving you an update on that soon towards the end of this call. We have 1 school-based health center, which is our newest site, and we look to grow on that, certainly with 26 school-based mental health programs and 2 senior wellness centers to the Department of Aging and Community Living. And again, where I'm sitting right now is I'm sitting at the Fort Totten location, which is adjacent and on top of our, I'd like to call our Siamese twin, Berea Public Charter School. And so, we have 2 charter school affiliations with Berea at the Georgia Avenue site, the Petworth site, the Kalorama/Ontario Road site, and the Fort Totten site. And so many incredible activities that are going on there to just really focus on the social change model. And so with that, I wanted to hand that over to Dr. Mueller so she can speak a little bit more about that.
Thank you. Very nice to be here with everyone today. Thank you for taking the time to ask us questions and hear about what we're doing here. You probably are somewhat familiar with the social change model, but it really defines the type of care we provide at Mary Center. And it's one of the reasons that I came to Mary Center 10 years ago. Maria Gomez, our founder, and the team that she worked with at the time, and now Dr. Elliott, everyone at Mary Center believes strongly that treating health problems alone is not enough. You can't treat anything in a vacuum. Giving someone a prescription that needs to be refrigerated doesn't work if they don't have power. All of these things are just so interconnected. And so Mary Center is a place where we don't just treat the health problem. We do our very best to treat health problems very well, like, that's what my team does. But the other 710 employees that we have at Mary Center do all of everything else, right? They focus through our school. We do dual generation education, which means that we try to educate parents at the same time we're providing early childhood education services so that parents are better able to support their children, both economically, but also just support them in their educational endeavors. And we provide social services. And those social services include our family support worker team, who can help children and parents, those without non-parents as well, just help everybody navigate what is a really complex system, particularly if you're doing it often, as the case for our patients, in a second language. The services that we provide and the services that are available to our community members go hand in hand. In my case, I've seen, as a benefit of the BRIA program, young adults now able to come and sit with their grandparents and help them navigate their hospital discharge and rehab needs, and then help with the help of our family support workers, be able to apply for services in the city that allow them to be paid to care for their loved ones, right? And DC is a wonderful place to be able to practice community medicine, in that there's a lot of desire to support this community. And so our team at Mary Center really helps our participants and community members do the best they can with what is in the community. And we, Mary Center, are one of those resources. We get participants referred to us from hospitals saying, we, Hospital X, big academic institution, don't have what you need. You need a place like Mary Center. And that is something that is really special. Very often academic institutions think of themselves as the ivory tower that has everything. And we're not an ivory tower. We're in the community. We're in the basement of an apartment building. We're next to schools. We're where our participants and community members live. And we help make a better life. Dr. Elliott, do you have anything to add? Oh, it's so different in Zoom as opposed to Teams.
Right. I think that I think you pretty much hit it square on the head. I'm an OBGYN by training, and all that goes out the window if there's concerns with food insecurity, housing insecurity, intimate partner violence. All that goes out of the window if there's concerns with their child's education. And so, these kind of things that Dr. Mueller just talked about are so very, very, very relevant to just the great outcomes that we are able to find ourselves in. So thanks, Dan. One of the things that we're obligated to do as a federally qualified health center is to have what is called a sliding fee scale. And we, here at the organization, they say the slide. And so the sliding fee scale is something that any individual, irrespective of their coverage status, whether or not they have insurance or do not have insurance, if they find themselves on the list with a family of up to 4 or more, find themselves in a space where they make less than 200% of the federal poverty guidelines, then they fall within this slide. And so there are people out there, it might be prohibitively expensive for them. And so if they still fall within that space, they are eligible for the slide. And then there's others out there that have no insurance, they have nothing at all. And so the goal in that slide is to make sure that it's applied uniformly to everyone, but also not to have it so that healthcare is a barrier. We don't want to find people show up and then say, well, I just can't afford this, and then they walk out. And so they can go down to as low as $20 per encounter. And we understand that. The federal government understands that, and we are very proud of that because we have, last year alone, I believe we gave away approximately $7.2 million of uncompensated care. And when you think about the number of individuals impacted during the pandemic, we had roughly 250 pregnant women that were positive for COVID, and roughly half of them were in Prince George's County. And at that particular site, in some months, it's up to 80% of the women have no insurance at all. They're not eligible for insurance. And so that sliding fee scale has done wonders. And I will say that, during in the thick of the pandemic on March 18th, 2020, all of us got together in leadership, myself, Dr. Mueller, and several other medical leaders. we decided that we were A, not going to close our doors. B, we were going to stay open for pregnant women. C, we were going to stay open for kids 18 months and younger, and then for vulnerable adults. And I really think that made a huge difference in terms of access to care. So the sliding fee scale is just a part of all the things that we do, but it does speak to how to make sure that healthcare is affordable and accessible. Sarah,
I
after
also
you.
had to find the mute button. I just want to add on to what Dr. Elliott was saying, that that is why donations from individuals and foundations and our corporate partners are just so impactful. As Dr. Elliott said, not all of our participants can afford, to pay for their appointment, or, can only pay for part of the appointment. So just wanted to give a few examples on this slide to show you how, your contribution makes a difference here. For example, discounted medical visit for an uninsured participant is $150. That person may only be able to pay $20. So it's just so helpful when we receive contributions from our generous supporters to help us enable to ensure that these individuals can get the care that they need and deserve. But I'm going to go ahead and move on to the next slide and allow Dr. Elliott and Dr. Mueller to give some information about updates and exciting news here at Mary Center. You're on mute, Dr. Elliott.
That is so horrible. I should know this by now. So we are at just at our 10th anniversary at our Prince George's County site, which is co-located at a facility that is owned by Prince George's County Public Schools. As you can see in the side of that picture, the right side, it says the Judy Hoyer Center. And then there's Cool Spring Elementary. Well, the school system is going to have to tear that building down. And they've been really good at giving us advance notice. It's probably not going to be for another, we'll say, hopefully 18 months. But we recognize we need to be out of there once the shovel hits the dirt. The design of that building is going to take anywhere between 15 to 24 months for completion, which means that if we were to stay at that exact location, we would have to move out. We'd have to find a space, move out, get set up, be there for 15 to 24 months, and then move back. But there's one challenge with that. It's slightly less than 3,000 square feet with a large volume of individuals that we serve. And we recognize, since we don't have a robust accompaniment of behavioral health, dental, and other resources, we recognize that the best bet is just to find a site deeper into Prince George's County, but still serving the communities that we've served. And so we've located a few spots. We feel very optimistic about it. There's no ink on paper that's dried yet, but we are looking to make sure that this new version of Mary Center, Prince George's County, is roughly the size of our George Avenue site, which is about 22,000 square feet. So you have all the services that are there, including BRIA. And so we're working with BRIA and in the background to see where they can fit in that space as well. But there's a lot of opportunity that's happening there. And the main reason we'd have to depart that place is that when they do rebuild that space, it's only going to be 3,000 square feet that would be shared, which clearly isn't enough room. But at the same time, we also recognize that having been there for 10 years and a decade, we know that there's so many other resources that we can bring to the community, and that's what we aim to do. But when it does come back online, we aim to have a school-based health center there. And so we're not going to leave the place entirely, but we recognize that we can expand it and become more robust. Dana, did you want to add anything about the services that we do?
Oh, I was just really excited. I hadn't heard the size of the footprint for the new building. So I work at our Petworth location, which is about a good traffic 15 or 20-minute drive from Adelphi. And so I see patients who drive past Adelphi to Georgia or Petworth because we have more space there. We have more providers there. And there's such demand from the PG County community that, either even being closer, providing them with the Georgia level experience, I'll say, which is, our biggest and kind of most comprehensive site in Prince George's is just going to be such a wonderful addition for that community. Because right now these patients, will drive 30, 45, 50 minutes, even farther. I've got patients who come from north of Baltimore because they know they used to live closer and they know the care we provide, the service we provide, and they want to receive those from us. They want to stick with us. And so it's great that we're going to be able to provide them with more services. And I'm particularly excited because it means more room for, I'm an internist, adult care up there. So much, we've really grown that team in the last 2 years for adult care at our Prince George's site. And there's just huge demand in that area, and they've made some interesting potential expansions to insurance coverage for some populations. And so it's really great that we're going to be there to meet that need without a gap.
So we're really happy. We know that the social change model can, thank you, Dana. We know the social change model can be implemented whether or not you're in the hills of Appalachia or in an urban environment. And so this is just, it's just a commitment to the communities that we've been serving. But the other thing is dental expansion to Georgia Avenue. And so we are going to be adding 2 new operatories to the lay person such as myself. I would just call them dental chairs. But the operatory would make sure that we could expand into spaces and add more services to that dental site. We're actually going to knock out a wall that's normally used as a conference room. And so one chair is going to be a traditional chair. The other chair is actually going to be a lift. And that lift is going to allow us to take anybody that's in a wheelchair or any sort of disabilities. They just roll right into that lift. It can hold up to, I think, 1,200 pounds. It flips back just slightly, ever so slightly, and allow the dental team to go ahead and do the work that we do. So not only is it going to expand the level of services that we have, but it's also going to expand, the population of people that we can serve. And so that's long been a challenge for individuals with disabilities in oral health. Dr. Mueller, after you.
Thank you. So the long COVID clinic and our geriatrics clinic are 2 new exciting services that we have and we're offering to patients at our Petworth location, but that are open to Mary Center patients without restriction. Our doctors can only just be in one place at a time. And so I'll focus first on the long COVID clinic. Obviously, this is something that none of us were thinking about. Well, maybe some people, very prescient people, were thinking about it 3 years ago, but 4 years ago, none of us were thinking about. We have Dr. Sarah Lee pictured here, who is an infectious disease specialist. And for a long time, she's been at Mary Center, I think almost 8 years now. And her focus has been treating HIV and hepatitis C, providing pre-exposure prophylaxis medications to patients at risk of HIV transmission. And during COVID, particularly in the early parts of COVID, Dr. Ali was an essential resource for us as we thought about how to safely provide all types of care, and then also how to take care of COVID patients. Mary Center, as I'm sure you've heard through the years, and as Dr. Elliott suggested when he referenced the high rate of COVID positivity in the pregnant patients, Mary Center's patient population was very heavily affected by COVID. These are frontline workers. These are people who clean hospital rooms. These are people who load grocery stores and delivery drivers. And so many of our patients got COVID in the first wave, in the first and second waves pre-vaccination. And we know that that's the population who is at highest risk of long COVID. And Dr. Ali has been working with Dr. Elliott and our Executive Vice President of Medicine to develop a long COVID clinic at Mary Center, knowing that the waits at the academic centers are very long. And so what she's providing are kind of longer visits to help coordinate care, make sure that people are getting other medical conditions ruled out, and providing them with direct connections to behavioral health and helping them enroll in physical therapy to support different aspects of their recovery. This just started this spring, and so we don't have outcomes yet. The word of mouth outcomes after the fact seem to be very good. And we're hoping to have more objective data, other than, well, I really felt like she listened to me and she didn't say, the dizziness is in your head, right? We're hoping that we'll have objective data after a couple of more months to look at these patients and say, are they improving? Are they experiencing improved quality of life? Because that's what our goal is. The other service that we have launched in the last year and a half is a geriatrics clinic. Dr. Laura Blinkhorn, pictured here, is a family medicine physician with a gerontology fellowship. And she came to us from the West Coast 18 months ago now. She practices at the Silver Spring Clinic, but it does her geriatrics clinic in DC. And she is seeing older patients on consult service. So this isn't to say that all of our older patients are being seen by Dr. Blinkhorn exclusively, but that when a older patient has a particular, we'll say, kind of age-related question, right? Is this depression or is this dementia? What, other than their arthritis, is there a mobility disorder like Parkinson's disease that's affecting this person's safety at home? Why are they falling? That really can't be addressed in a typical primary care visit just because of the time that is required to fully evaluate some of these concerns. We're now able to ask Dr. Blinkhorn for help and set our patients up to see her, and she can evaluate them, send them for testing if necessary, and bring them in. She's also working with a social worker to help outreach regarding services in the community. And we're really hoping to see this program continue to grow in the next couple of years. Our aging population certainly is growing. And so there's high demand for her. She's booked out through the summer as it is. And so we are seeing benefit from that program already. Dr. Elliott,
Yeah,
any to add on these programs?
Thank you, Dr. Mueller. The interesting thing about Dr. Blinkhorn is that we have meetings annually called community conversations, and the staff had felt it. We saw it in the community conversations. That was a topic about how to care for older adults, and so Dr. Blinkhorn was the fruit of that. We heard loud and clear from members in the community. We heard it from the staff, and we were able to bring on Dr. Blinkhorn. And certainly, we're looking to make sure that we can expand on that and expand those services to make sure there's representation, if not at all sides, certainly in both jurisdictions where there's robust accompaniment. I can say that it is, as a member of the sandwich generation with an older parent and children, it is something that means a lot when you know that when your parent goes to the doctor and you're feeling as though they're getting the care that they deserve, you sleep better, you have fewer questions you have to answer to your parent, especially as a physician. They feel like they're getting everything that they need. One of the things I forgot to mention about the dental chairs is that was through generous support through the Shatner Foundation. And so they have been absolutely wonderful in supporting us in our efforts. And when Dr. Gesker came up with the idea of adding more space, that was something that was really, really appreciated when they came.
Wonderful. Thank you, Dr. Mueller and Dr. Elliott. So now we can move into our Q&A session for this program. So feel free to submit questions in the Q&A toolbar option, or I also have some questions that I'm going to read off that were submitted when people registered. So the first question is, has Mary Center been impacted by the buses of migrants sent from other states to the district?
Yeah, I think impact is it can go in a variety of different directions, and I'll hand off to Dr. Mueller. But number one, we get calls regularly. We have relationships with SAMU and other organizations who participate, and this is part of who we are. We've been caring for immigrants since we started. And so when we did get the call out for the migrants that were coming on the buses, it was not unfamiliar to us because we've also taken care of the parolees that came from Afghanistan. And so we do have a team of individuals that work internally that immediately just get together and say, okay, where do we go? What are the resources? And sometimes it's linking. So people reach out to us because they feel that we can do everything. But sometimes the best thing is to say, hey, look, in beneficence, we actually need to think about them and to recognize that there are some people out there that are doing much stronger. And so we're working on that in a much broader context. But yes, we have taken these individuals in to provide care. And the challenging part in those situations and those settings is sometimes they're not going to stay in the area for long. So really, you're trying to make sure that they're at least stable before they go on to the next destination. How they got here is a totally different political hot potato, but the main thing the only thing we care about is just making sure that the individuals care for with dignity. And so in those situations, that's what we do. But Dr. Mueller, did you want to add anything?
I would just say that, I rarely ask how a patient ends up in front of me, right? They're here, they need care, and that's our job. And, I may ask them, when did you arrive, if that's clinically relevant, or how did you get here, if it's clinically relevant. But the point is that they're there because they need help. And whether that help is a refill of their medication or a depot shot, or, they fell, as they have an ankle sprain that hasn't been addressed because they walked a lot of miles, right? Before getting to the border. Like, all of those things are things we deal with, whether they arrived in DC voluntarily or involuntarily. Our operations team and that response team that Dr. Elliott mentioned does do some kind of, hey, this person is in a shelter, but they need medical attention right now. They're being housed and they're going to be relocated, but we need to address this issue. This person is pregnant and this needs to be helped, or this person has a cough and they're just worried about having them in that housing. Can you see them? Can you make sure that it's not XYZ so that we can help them get to the next stage? And as much as possible, Mary Center says yes. I mean, that's one of the great things about Mary Center is, as much as possible, our team's answer is yes. How can we help? Even if it is bandaging the situation to say, like, we're not the right long-term solution for you. You're going to end up somewhere else, because you shouldn't have to take 3 buses to come see your PCP, right? We are not in every part of the city, unfortunately. And so we help where we can and when we're asked to. And that's just kind of the ethos that we have, whether they're fresh off a bus or fresh off a plane, or, have been here for 30 years, but just haven't had care, right? They didn't know that we were open to patients who didn't have insurance. And so they heard that we did, and now we're here. That's what we do.
And there's some unfortunate realities out there. A lot of, I'm an OBGYN by training, and a lot of OBs and cares for pregnant individuals, they're very reluctant to take somebody late in the pregnancy because they're worried about the medical legal risk. That's not the issue. The issue is they need care. And so there are some people that are there's some people that run from the fire, and there's some people that run to the fire. And I would like to believe that as an organization, we tend to run to it and to say, how can we help? And so some situations we've seen that individual one time, we have to send the labor and delivery and they have the baby. In other situations, we see them, once we get the sonogram, we scan, we make sure the dating is correct, and then we make sure that everything is set and they're on their way. But it's challenging, not without the work, but yes, we do see them.
And I just would like to add that we also are supporting migrants when they come, and we provide them with like dental hygiene kits, other essential items, shampoo, soap. And so we actually have an Amazon charity wish list going on where we are inviting people to purchase items that will be sent directly to Mary Center. I will put the link for that charity wish list in the chat in case anybody's interested in checking it out. But that is something that we have been, an initiative that we've been doing since the migrants have been started to be bussed here. So.
Can I add one more thing?
Yeah.
We had a call, and I forgot the name of the organization, but they were working with the State Department, and they had done a humanitarian gesture. I believe it was with Nicaragua, and they had brought up about 200 individuals, and they reached out to us for dental services. And we were able to link Dr. Desker with them so they could do a teledental visit. And I mean, so it really does go back to what Dr. Mueller said about, we don't say why we do it. We typically say, why not? Let's just figure out a way to make sure we can get them into care. And so those are the kind of activities that we're going out of our way to make sure that we can just be there and be present.
Great. So our next question is, have there been any changes to the social support network, including funding in Prince George's County since the pandemic?
Yeah, I think that number one, there were some Fed and state funds that went in to support individuals that were uninsured. So we were very happy with that. I do think that social services are always a challenge. What we do in terms of social change model and the services we provide for social services, those generally don't get reimbursed like we do for the core services of med, dent, behavioral health. And so I would say that the pandemic and the funds that came through were definitely a blessing and definitely helped us kind of stand those up. But at the same time, it's over. We're not wearing masks anymore for COVID. Now we're wearing masks for a forest fire that's happening up in Canada, right? And so the resources for that are different, but always at risk. And so we're trying to find ourselves in spaces where we can just make sure we stand that up. But I do want to give credit to the Prince George's County executive, leadership from Prince George's County, state delegates in Maryland. They really do and have been they've recognized the work that we do. And so whenever there's an opportunity, they reach out to us and let us know. But there's always not enough based on the complexity of care and that is needed.
So the next question, what are the opportunities to work with other health centers and community partners on our priorities and goals at Mary Center?
I think, I want to hand that off to Dana and give her a chance to talk about that, because she too deals with a lot of these engagements, and then I can certainly add on after that.
Yeah, so on a micro level, we get a lot of interest from, for example, senior centers, even the ones we're not affiliated with, right? Can you come talk to our participants about, about hypertension? Can you come talk to them about heart disease, right? One of the things that primary care, which is what we all are, tend to be good at is explaining specialist speak. And so we get a lot of, hey, can you explain to our elder community what fibrillation is? Because even though it's a cardiologist do all day, people leave those appointments confused. And so we do a lot of community education. And then we also kind of get directed outreach for community events. We have our public health outreach services that will be at events like Pride this weekend, should it go on, right? That will be at events like community block parties and church events, doing testing, whether it was before it was COVID, it was HIV testing, handing out information on PrEP. We do a lot of in the community engagement, because that's where you meet people, right? That is where you find out what their needs are. And then, we learn a lot from those, even when we, are there to teach, is because we come back, we say, this is what's going on out there right now, right? A lot of many of us, particularly at the clinician level, don't, are not in the community necessarily in the neighborhood, I would say, of our participants. And so we're hearing different things, right? And we learn from those engagements. On a higher level, we have, academic relations with the hospitals. We get residents coming in, and so we partner with those organizations. We get students from all over trying to have experiences at Mary Center, and our VP of Clinical Education, Dr. Maria Marquez, who is based at Fort Totten, works to develop those relationships. That's just a off the top of my head bit. Dr. Elliott, do you have anything to add?
Yeah, we have, we're a member of the primary care associations, both in the district in Maryland. We do have regular engagement with Prince George's, Montgomery, and DC. We have what I think are very strong relationships with the fellow community health centers. We recognize that some have greater strengths than others. We are not perfect. And so therefore, in certain times, we have to actually hand that off to, hey, what do you do that's best practice that can help us get there, and vice versa. We also recognize that care coordination is going to be huge. We know that patients do land in our clinic. They may land in another clinic, so we're working there. And we definitely have relationships with hospitals. I would say that we have a very strong relationship with Adventist. Adventist, as some may know now, is overseeing the management of Howard, but they also have White Oak Medical Center. So there's regular meetings with the maternity health services for White Oak. We have a regular meeting with the Howard Faculty Practice Plan that we're working on engagement to figure out how we can better coordinate care of services. And at the same time, we have a relationship with Sibley and GW and MedStar. Sibley's been doing absolutely wonderful in reaching out to us and Hopkins Sibley's been doing absolutely wonderful in reaching out to us, in particular with maternal health. We recognize in the District of Columbia, maternal health outcomes are not acceptable. And so I think it's pretty safe to say that every entity in the city is focusing on maternal health, and we're just happy to be a part of that and have a voice in that. And then recently, Dr. Pal Davis, who's our new Executive Vice President of Medicine, she's currently also the Director of Women's Health. She actually is on the Fetal Infant Mortality Review, Maryland as well. And so there's a lot of collaborative processes going on and engagement. And that's just a snippet of things that are happening. I mean, there's a deep dive with addiction services, and so many other aspects of what is happening here.
I think this next question actually goes well with our work with talking about partnerships. Can you explain the relationship between BREA and Mary Center a bit more? Is donor money for Mary Center shared directly with BREA charter schools as well?
Right. So I commonly refer to BREA as our Siamese twin. We are attached at the hip. The social change model exists with both of us together combined. And so in terms of our relationship, you have settings where we are referring children to BRIA, and sometimes they're referring their kids back to us for care. Or we have people that are looking for career development. We have a medical assistant training program that BRIA runs that also works in conjunction with Mary Center. With respect to the money and respect to the donor money, when individuals do come through and they don't donate money to Mary Center, Sarah, you can have this on the call, but you could probably throw a chat your way. That I envision that, just like BRIA, they too have their own team of people that go out and solicit through development to find resources there, because there are people that want to target and earmark their money for things that are associated with early childhood education, adult education. But Sarah, did you want to add anything to that?
Well, yeah, so I think whenever we talk with donors, it's really important for us to share our work with BRIA public charter schools, and just because we are so collaborative, but as Dr. Elliott said, they do have their own team to make sure that money is earmarked specifically for BRIA programs, and they also have their own board of directors, which is separate from Mary Center. Anything else on that, or I can move on to the next question?
We have 7 minutes left, so let's just keep going.
Okay, so what are Mary Center's greatest needs for the next 2 years?
It's interesting in that one of the things that's changed through our EVP, our Executive Vice President of Development, Heather Morgan. She and I, if not every day, we talk so often. But one of the things that has changed in terms of giving is general support dollars. A lot of the monies that come in are earmarked towards certain activities and goals. And one of the things that we discovered, especially during the pandemic, is when that happens, you can't pivot. The money can't pivot into spaces that you need. And so when we wanted to do things that were related to how we operated the site, couldn't use the money there. We were so very appreciative, and we had to use it for as it was designated. But I think that just in the giving realm, the general support dollars have actually gone down, and you're finding more people giving towards particular activities. And so I think that that is one of the biggest needs, to have general support dollars that can go towards having the ability and the capacity to pivot and extend into other spaces.
And I'll add on to the general support, the importance of general support. It's that, as Dr. Elliott and I were talking about earlier, there are so many uninsured participants and those who we provide uncompensated care for. So as Dr. Elliott said, we provided over 7 million in uncompensated care in 2021. And so it's really important that we have this general support money so that we can apply it to help us supplement that uncompensated care that we provide. Another question that I'll take on is what are small ways that we can volunteer? And so we like to say at Mary Center that there's something for everyone. We have some virtual opportunities that you can do at home. For example, writing cards for our senior wellness participants and just kind messages to them that we can then hand out at our Bernice Fontenot site and Hattie Homes. We also have on-site options, including in-kind donation sorting. During the holiday time, we have a Thanksgiving food drive, and we provide meals to, I think last year was about 400 families. So we often need help packing and preparing those meal kits. Similarly, we have a holiday toy drive, which we need help sorting so that we can give toys to the appropriate age participants that we see. And then we also offer corporate service day opportunities, which we partner with corporations in the area and allow their team members to come on site. We have had them help with site beautification. We've even had them provide little trainings to our teen program on different skills that might be helpful for them. So we'll include and it's already been added, thank you, Victoria, the Mary Center link to learn more about volunteer opportunities. And we do have children come and help, we have adults, so definitely take a look at that link. The next question, how goes the program to provide financial support for staff entering the nursing program? So to give a little background, in 2021, when our founder and CEO of 33 years, Maria Gomez, announced that she was stepping down. We created, our board actually created a special fund called the Friends of Maria Fund, which would help provide nursing scholarships to mostly entry-level staff at Mary Center who are interested in pursuing careers in nursing. So the scholarships launched last year, and we awarded 5 scholarships. Most of the recipients were medical assistants, and so they're hoping to further their career and become nurses, which is wonderful. We recently launched the applications for our 2023 scholarships, and we did that during National Nurses Week in May. We plan to announce the awardees in July. And I just want to thank everyone who supported the Friends of Maria Fund and helped us reach our goal for that scholarship fund and helping our staff members who are interested in pursuing careers in nursing. Dr. Elliott, I don't know if you want to add anything else about the Friends of Maria Fund.
No, it's been great. I mean, actually, it's done exceptionally well. And it's just, we're looking at how we can expand on that. Certainly it's designed to make sure that it's in perpetuity. But I know that Derek Kaufman, who's the EVP of Health and Programs and used to be the Chief Nursing Officer, she herself is very proud of how it's been going. And it's something that, you know, to see this seed that Maria planted that is now in this space where we have 65,000 individuals and is now leading to medical assistant training and nursing and hopefully dental assistant training. It's just a wonderful thing. So no, you did a great job summarizing it. So thank you.
Wonderful. I think we have time for one last question. And Dr. Elliott, I see you answered this in the chat, but just in case, I think it would be good to just share it out loud. Someone asked about the languages available among staff for client and contact and services. Do you just want to summarize what you shared?
It's a good question. And Dr. Mueller can correct me if I'm wrong. Basically, over 90% of the staff are bilingual in English and Spanish. In addition, we have staff that speak Amharic, Tigrinya, I can never say this word, Tigrinya, French, and other languages. We also have a language line and a service for the hearing impaired. Our site at the Petworth site, for those that may not know, the district area, the DC area, has the largest concentration of East African immigrants in the United States. And so as such, you have a lot of individuals that are from Ethiopia and Eritrea. And so we actually have a number of providers that speak Amharic at that site. So Dr. Workney speaks English, Amharic. I don't know if she speaks Spanish. She might. She's been here long enough, I guess, to know it. We have and she's the medical director of the site. We have Dr. Jacita Dane. She is the clinical lead for adult and family medicine, and she speaks English and Amharic. And then we have a family nurse practitioner who speaks English, Spanish, Amharic, and Tigrinya, which is, there's a certain sense of peace and calm when people come in the room and they can hear the language that their native tongue is in. So, but yeah, Dana, did you want to add anything to that?
I speak Spanish too, but yeah, one of the Petworth site is, so DC has a rule that if you're offering, if like a certain threshold of your population speaks a language, you have to provide information in it. So when you walk into most of our sites, you see English and Spanish on the bathroom doors and things like that. At our Petworth site, we also meet the threshold for Amharic. And so it's certainly not a prerequisite that you have that you be multilingual. The prerequisite is that you provide good clinical care and that you want to be, serving the community in the way that Mary Center does. But it is certainly a bonus. And when we found that nurse practitioner that Dr. Elliott spoke about, when she was referred by a employee and we saw her, and we were like, oh yes, please come. Your patients are going to love you, and they do. So
it's really hard to find providers that are bilingual. It's also hard to find providers of color. I think basically of the physicians, I think across the country, 5.7% are Hispanic and 5.6% are African American. And the number of African American physicians hasn't changed for like 100 years. And so when you find somebody that has that skill set, and even more so is clinically sound, we do everything we can to make sure that we bring them on board. And so we're very fortunate to have them here.
Well, that actually wraps up our Q&A portion of the program, and we are out of time, and I want to end promptly so to respect your time. So I want to thank Dr. Elliott and Dr. Mueller for sharing those updates and answering our questions. I also, of course, want to thank each of you in our audience for joining us today and spending part of your morning with us. And finally, I just want to thank our incredible supporters. We really appreciate you helping us further our impact in the community and helping to build stronger and healthier communities. So that is all. And if there are any questions that we didn't answer, please feel free to reach out to us. And if you thought of any questions after this, don't hesitate to contact us. So thank you so much, and I hope you have a great rest of your day.
Thank you.
Thank you all for your time.